All right, I'd like to welcome everybody to this joint Caddo COVID-19 press conference streaming live here on Facebook. We're joined by Sheriff Steve Prater, Parish Administrator Dr. Wilson, Dr. White, the Regional Director of Region 7 OPH, and Mayor Adrian Perkins. They're going to be providing an update on the COVID-19 response here in the local area, and reporters are also joining in on the call, so they'll have an opportunity at the end of the call to ask questions. And we're going to begin with Sheriff Steve Prater.
Everyone knows we have 140 cases in Caddo Parish, and now we have 3 deaths. And I bring those numbers up to tell you how serious this situation is. You've been with me through floods and tornadoes and multiple shootings and all sorts of terrible things through the years, and we've never quite seen what we are seeing now. So I want to emphasize to you how this is uncharted territory, and I want to emphasize to you how important we need to take this. We don't really know what kind of tiger we got to hold the tail of, and so we need to treat it like that. I want you to understand that the governor's order to stay at home and the only essential businesses, it's very hard to define, it's very hard to police. It's almost impossible to, we're not going to stop cars and that sort of thing, but we have to count on you, each of you realizing how serious this is. It's serious not only to your own health, but it's serious because we've got to stop the increasing caseload for a number of reasons. We got to think about our elderly and those that are not as healthy as some of us. We have to think about them. We have to think about the surge in the hospitals and things, terrible things that could happen there if we overload our medical folks, and they are working their butts off right now. And so we got to think about that. So we have to stay home, limit your trips, limit your shopping sprees. Don't go places you don't need to go. Don't gang up, and just sit back and work with us on this. We really need you to do it. We as leaders, we're working every day, every hour. We're the folks you'll hear today, we're talking on an hourly basis, almost round the clock, trying to figure out what do we do about this? What do we do about that? So to keep up with the information that's coming out there, you need to really keep up on the websites. The Caddo Parish Sheriff's website has everything. The City of Shreveport, the Parish of Caddo, we all have all the information. You just have to seek it and you have to find it, but it is there for you. Any agency that has something you need to put on our websites, please get in touch with us. I want to tell you some of the questions we've had was, are there any prisoners with COVID-19? And no, we have no prisoners, thank goodness, at CCC with that. We do have it in our Caddo Parish Sheriff's community. We have some positive cases, as they do at the Shreveport Police Department. So some of your first responders have been affected by this. All the more reason that we should not take this lightly. This is a very, very serious thing. So in closing my part of it, Dr. White will speak, and Woody Wilson, the head of the commission, the director of the commission, and then the mayor will close us out, and we'll be having some questions and all. But again, I want to tell you, take this seriously. We don't really know we don't know the extent of this. We don't know how it spread. We hear that it spread asymptomatically, that you have to have symptoms or not symptoms. There's just so many unknowns about this. So treat it seriously. This is not a laughing matter. You know me, I don't say things like that if I'm not serious about it. And so take this seriously. Dr. White?
I just wanted to tell everyone today that, we've been saying these same things for about 2 weeks now. And as we've watched our numbers climb, our voices and our demeanor gets more and more serious. And it's because we really want to impress upon everyone that this is a very serious situation. We have a lot of people hospitalized. About a quarter of our of the people who are ill are hospitalized, that's tested positive, of course, and about a quarter of those are on ventilators. So the people who are getting sick and hospitalized are getting very sick. We also want people to understand that while in most of the world this disease has been primarily seen as a disease of people who are 50 and older, and that your greatest risk is as you get older from 50 on. However, in the United States, we're seeing a change in that. We are seeing a high percentage of people 44 and under. About 55% of cases hospitalized in New York City, which is our kind of epicenter in this country, are below 44. Uh, we know in our area we've had deaths of young people, 34, 44. So we really want people to realize while might be less likely to get as sick, you can become just as ill as an elderly person. It doesn't preclude you from becoming that sick. So please follow the governor's orders. Please stay home as much as you can. Please social distance when you have to go out. Realize there are a lot of ways to praise the Lord and worship without sitting in a church pew, that you can do it and at home and in fellowship with others through technology. Please realize that all of these things like birthdays and weddings and unfortunately funerals that we celebrate throughout our lives are things that we can celebrate in a different way. We can still be with each other, the people that we love and care about, but some of these will have to be postponed and some of these can be handled in a different way. But understand that when you're doing this, you're not just protecting yourselves, but you're protecting your community. The sooner that we can flatten this curve, as you've heard, the sooner some of these restrictions can be lifted. If we don't do these things, then these restrictions are going to get more restrictive, and we're going to like them less and less. So that's my request to you is please pay attention, please care about your community, and please realize that every individual we all are the ones that are going to make this change. We're going to be the ones that will fix this problem on our own and as a community. Thank you.
Next up will be Dr. Wilson.
Okay, good afternoon, everybody. I want to assure the citizens of Caddo Parish that the Caddo Parish Commission is continuing to provide the community with essential services. We had to scale back our operation in an effort to fully comply with the governor's mandate for staying at home. Also, I want the community to be aware that your state and local government agencies are doing all that they can to alert, inform, and advise the community on the best course of action in response to the crisis with the COVID-19. My concern is that we take this matter serious and listen to our medical community and our Homeland Security officials. This is not overhyped or sensationalized news. To the contrary, this is a matter of life and death. The number of COVID-19 infections in our state and our area is alarming, and we cannot fail to act in a responsible manner. That concludes my comments.
And now it's Mayor Adrian Perkins.
All right, thank you. First of all, I just want to thank the community leaders for coming together on this call so that we can speak to the citizens of Shreveport and Caddo Parish before this weekend kicks off. So thank you all for being here. Also want to thank the media outlets as well for tuning in and hearing our remarks. But what I really want to point out is we've had a really rough week here in Caddo Parish. The numbers continue to go up, as the sheriff already talked about. Since Monday, March 23rd, we have seen our numbers rise from 34 to 140 cases, a 311% increase. We've also experienced our first, deaths related to coronavirus as well. We have had those 3 deaths within the last 48 hours or so. But we're also praying for those who have loved ones that are being currently affected. These numbers are very concerning to me, and they should be concerning to everybody. This is why I want to continue to stress staying at home right now. If you must go out, make sure you remember the social distancing and you stay at least 6 feet away from anybody else that you might come in contact with. But this virus is spreading across our country, it's spreading across our community, and there is no vaccine right now. We have to rely on those social behaviors like social distancing, like washing our hands to really disrupt this disease, this virus. That's why public buy-in is so critical. I don't have enough police officers. The sheriff doesn't have enough deputies to be out there to make sure everybody is doing the right thing. This is truly a team effort. We all have to come together as a team. We all have to come together as a family to do the right things and not think that we're immune to this disease or it won't impact us, or just because it's not in our household, we don't have to behave accordingly. We need everyone to remain calm, but take this situation extremely seriously. I'm a millennial myself. What hadn't been specifically talked about is that third death was a 35-year-old citizen. I'm 34. That's somebody that's 1 year older than I am. We are not immune to this. Millennials aren't, Gen Y, younger people, we are not immune to this. We've had a teenager die in New Orleans. So we have to take this seriously, and we need to take the advice of those medical professionals out there as well. But I really wanted to emphasize that before going into the weekend. I know our minds are thinking, hey, it's the weekend, it's time to go out or let loose or something, but we got to remember this weekend will be like every other day this week. The governor's order to stay at home is still in place. So remember, only go out if you have to do work, if you have healthcare needs, or if you have nutritional needs, if you need to go out and get food. That's the only time, we should all be leaving our house because we place ourselves in jeopardy and we place others in jeopardy every time we do that. Before I open it up to questions, I want to emphasize some changes that's taking place at the city over the next week. Each Monday, while schools are closed, Fort Tran and the city of Shreveport will provide free transportation to Caddo Parish school-aged children on Fort Tran buses between the hours of 7:30 a.m. and 12 p.m. This effort is to assist students with transportation to establish the established Caddo Parish feeding sites. School meals will only be distributed from 8:30 a.m. to 11 a.m. on those Mondays. So that's the reason why we're adjusting to that time. I want to discourage anybody from using public transportation to joyride at this time. I've been getting multiple reports about that. Please use public transportation for those exceptions that I pointed out earlier. Another thing that I want to talk about, another big announcement today, is on the economic front. The city of Shreveport has partnered with Southern University of Shreveport, COHAB, the Greater Shreveport Chamber of Commerce, and the Shreveport-Bossier African American Chamber of Commerce to launch Shreve.biz. Shreve.biz is a help desk for Shreveport and Caddo area businesses navigating the economic strains imposed by coronavirus. The website contains useful information about the various forms of financial assistance that are available to our citizens. And it also allows small businesses to sign up for an in-depth support via phone or video conference, and it connects them to the SBA, disaster loans, federal stimulus, and those other resources that are out there. That concludes my comments. I'd like to open it up to media for questions at this time.
Okay, but it looks like tomorrow I might have to dodge some raindrops, huh?
Well, yeah, if you go. All right, I see that we have a question from KTBS's Bill Fuller.
And this is for the mayor, if he could. Mayor, the president just a short time ago signed the stimulus package. Your reaction to local citizens being able to get economic help and also the businesses?
Thanks. Yeah, my reaction is I'm grateful for it. And I've had to listen over the last couple of days, over the last couple of weeks. I've had to listen to our small businesses, employees of those talk about shuttering their doors. So to know that we got some federal assistance, it means a lot to me. It means a lot to our community. Period. Just some things about that stimulus package that we should also know is that Louisiana is estimated to get $1.8 billion in federal aid from that. So it's very important that if you're going through something right now, again, if you're unemployed, you reach out and you utilize the resources that are available. So yeah, it's great news for the country. It's great news for our community as well.
All right, I see that we have another question from Markel Sinet from KTAL. That's Jason Stevens.
KTAL, my question is for White. My question is, are there any projections for cases for our area for the next possibly 2 weeks to a month? Any projections for North Louisiana?
So, if we look at our trajectory, we're on the same path as New Orleans, as well as the same path as Italy. Our numbers rising per 100,000 if you're an epidemiologist, per capita if you're not, makes it a little bit easier to understand. The number of cases we have per people is climbing at the same rate as we saw at one point in New Orleans. So if we do not do something to flatten this curve, we could see our numbers continue to climb as, on the same path that New Orleans did. We can change that. We can break that chain if we can stop our socializing, increase our social distancing, and really, really, truly stay at home when we don't have to be out.
All right, we have another question from Christian at KSLA. Can you identify which handle you are, Christian, so that we can, in the chat, so that we can pull that up? Because we just have phone numbers here. We don't see your name.
Can you hear me now?
Yes.
Oh, there we go. This is for Mayor Perkins and Sheriff Prater. Have there been any sort of discussions about increasing precautionary measures to mitigate the spread of the virus locally?
Of course, there's been plans, and I've talked to the police chief, and we've about scenarios and different ways that if we have to do something. The truth of the matter is, right now there's a lot of mechanisms we could use as far as citing people and arresting them. They're all misdemeanors, and we don't really want to put people into our jails. We don't really want to cite anybody. We want people to use good common sense, because there's no way that we can police this many people in their coming and going of a day. We still having burglaries out there. We had a terrible deal where a young person almost drowned today, and the firefighters had to get in and rescue that person. So we still got demands for service, and we've gotten car wrecks, and we've gotten people that are getting really testy because they, just like everybody, they're tired of this. But we've got to just kind of chill out and realize we're in this for the long haul. So we might as well just relax and stay away from one another and stay home, and not make law enforcement waste our resources trying to police people that shouldn't be ganged up having big parties or going. And so that's what we want to emphasize. We don't want to scare people and say, hey, we're going to come out and start checking everybody that's driving around, because the truth of the matter is we can't do that. There's no way that we can do that. We're asking you to comply so that we don't have to get involved in it.
Yeah, and I just want to second what the sheriff said. That's what this is about. It's encouraging the community to do the right thing. We're not discussing going any further with our precautions, because we need to see how the virus reacts to the community and the precautions that we've already put in place. But the way we can truly judge that and truly measure that, and we don't have to explore more stringent constraints is by everybody doing the right thing and, you know, being real like team players and really good family members right now in the community. So we aren't talking about that right now. We're just monitoring where we are with the stay-at-home order by the governor, and we'll proceed accordingly.
All right. We have one more question for Dr. White, and it comes from KTBS as well. And we're also, Knox Andrus is on the call, who coordinates with all the local healthcare systems, and we're going to give him an opportunity to provide an update shortly. So KTBS can now ask their question of Dr. White. All right, while we're waiting on KTBS, we'll switch over to Knox Andrus, who can provide us with an update on the healthcare systems here in Shreveport. Knox, can you hear me?
I'm sorry. I apologize. I had to take myself off mute.
Yeah, go ahead.
Hey, good afternoon. This is Knox Andrus. I'm the Region 7 Hospital Preparedness Coordinator. I know many of you are working hard to practice good social distancing, appropriate hygiene measures to stop the spread of COVID-19. That's so important. It's been said over and over again. Can't say it enough. So for the hospitals, that means your efforts to minimize this disease spread is going to decrease the burden on the hospitals. And so we expect that burden, we expect that surge. And so we've been planning now for weeks, months, and actually years, if you go back to what Sheriff Prater was talking about, to all the disasters that we've been through in the past where there has been surge. But this is a surge unlike we've had in the past in terms of expected numbers. So we're doing a lot of things to be able to handle those healthcare needs that we expect. So we're coordinating not only with the hospitals that you normally would expect to come to when you have an emergency, but we're also coordinating with the many hospitals that also take care of patients that might be in a rehabilitation scenario or in some long-term acute care. We're also coordinating with our ambulatory surgical centers, which represent many resources for us. So we're coordinating with a lot of people to come together to help support this surge. We're watching what's happening in New Orleans. We're watching what's happening in New York. And, you know, it's unfortunate for them, but we get a little bit of time to learn from what they're doing, what they're going through, and some of their challenges, and that's helping us. One of the big things that we do is we coordinate with the Office of Public Health and with Dr. Martha White so that, again, we can be on the same page as much as possible. So a message that I would have is that, you know, if you think you're ill, you know, if you don't feel well, contact your healthcare provider, your physician. Don't run to the emergency room because that's the most convenient thing to do. In this day and age, we have folks that are used to going to the drive-up window and having it your way, so to speak. We like that convenience, but don't do that in this situation. Please try not to burden the emergency departments if at all possible. That's very important. Call your medical provider. That will help the hospitals deal with the surge that we expect. So with that, I'll conclude my comments. Thank you.
Thank you, Knox. And we are now going to go to KTBS for their question. Go ahead with your question.
Okay, Ben. This is for Dr. White. Dr. White, across Northwest Louisiana, there are over 200 cases. If you could, in general terms and round numbers, how many of those cases are tested positive but showing no symptoms, those that tested positive in the hospital, and those that tested positive that are in serious condition?
So it's a little difficult for me to say exactly how many tested positive in a private lab or, through a hospital. But what I can tell you is that through our case investigations, virtually everyone that we've spoken to had symptoms prior, which is what led them to be tested. Right now we are not testing asymptomatic people per CDC guidelines. If they change their guidelines, we may consider changing what we're doing. But right now, that's where we're standing. As far as how many hospitalizations, we have probably at least a quarter of our people hospitalized, and those people are very sick, from ICU not intubated to ICU and on the ventilator. So we are seeing a lot of very sick people, a lot of very sick young people. So it is something that I really hope and pray that everyone will take seriously and realize that you can not only help yourself, but your neighbor and your community.
All right. Well, there are no more questions, and so that will conclude our first virtual press conference, unless anyone else has anything that they want to add. Sheriff Prater.
A lot of misinformation that's going around as far as, can you pass this on and transmit this if you don't have symptoms? How long it takes for it actually to come to be once you've been in contact with someone, the incubation. There's a lot of misinformation and a lot of confusion, and you're hearing things in the national media that you hear all sorts of things. So try to get the best information you can, but understand one thing. Understand this is an unresearched fight that we're in. Nobody has all of the answers yet. We're giving it the best shot, and Dr. White's giving it the best shot, and with all of her vast knowledge, she's telling us what she figures is the case. But the truth of the matter is, we don't have the positive answers of where it's going from here. Understand that as you go forward. This is a serious fight that we're in, and treat it as such.
Thank you, Sheriff Prater. We have one more question before we get off from KSLA for Mr. Andrus.
Influx that we keep talking about, do we have enough ventilators, respirators, hospital personnel for that matter, ready to go if it does get as bad as we are predicting?
Are you unmuted now?
Hello?
Yes, go ahead.
Yeah, I'm sorry. I didn't get all of that question. I caught from ventilators and people. I think you're probably asking if we have enough resources to deal with the scenario. So, part of our disaster planning in our hospitals has been to consider what are our resources, how do we best use them. And so, thankfully, actually for some time, we've been stocking up on some of the resources you described, such as the ventilators. Several of our hospitals have acquired over the years emergency ventilators. Certainly, they have many ventilators that they would use on a day-to-day basis in the ICU setting. They have quantities of those. We have those ventilators not only in hospitals but in other medical locations in the city, in the region actually. And then we have personnel in those hospitals that are going to be tasked to. Normally you take care of one or two patients, on your shift. You're in an ICU unit, you might take care of 2 or 3 patients. Well, you might be having to take care of 1 or 2 more. If you work on a floor and you used to take, 14 to 16, you might be taking a little bit more. Now, we might get some other people to come in and assist you. We've had some volunteers that have actually called and said, hey, what can I do? And so we have a process for volunteers so we can augment hospital staff to a certain degree with volunteers, and for medical providers that can come from other clinical settings that are not necessarily an acute care hospital. So we are pulling together our resources to be able to support the needs of what's going to be going on in those hospitals with emergency departments. Over.
Dr. White, did you have something you wanted to add? I see the hand up.
Yes, I appreciate what Sheriff Prater said, and I just want to clarify just briefly. You know, this is a new virus. This virus didn't even exist in the world until the first part of December. And so what we want people to understand is we are learning every day about this virus. So when you hear, well, in China, they saw some transmission asymptomatically, we have not seen that here as much. CDC is monitoring and doing a lot of research on data. They're the ones that we are, as a state, turning to for our guidance. We can't jump from place to place to look for, guidance until that data is collected and we can assure that it's legitimate data. So when we say we're going to test you if you have symptoms and preserve our kits for that, that's why we choose to do that. Right now, what we're seeing is that people may be have been exposed to it. They may have the virus starting to replicate inside them and then develop symptoms, which is when they become contagious or can pass it to other people. What we want people to understand is the incubation period, so the time from when you are first around someone who is sick to the time that you get sick, is about 14 days. We really feel like most people start getting symptoms between the 6th and the 8th day, but it has been as far out as 14 days, and they're looking as it could go a little bit further, but they haven't been able to prove that. So the most important days are that first week, really. And that's when we start seeing people start having symptoms, and that's when they come and say, hey, I'm feeling bad, can I get tested? I just kind of wanted to clarify for everyone kind of where we were with that information.
All right. Anyone else? Any closing remarks?
I'll add to this. I think Dr. White did a good job of this at the beginning, but something worth reiterating again as we go into the weekend is that we fully expect these numbers to go up. We fully expect this to get worse. I don't want the citizens to be discouraged by saying, oh, well, we're doing all this, we're making all these sacrifices, and we aren't seeing the gain. Just know the numbers getting worse there's multiple factors to that. One is that we're catching up with testing. One is that we're increasing our testing capacity. So for a while, yeah, the progress in numbers, we will not see it. But I assure everybody, if you do the right thing, if you stay inside, if you stay away from people, if you continue to social distance, that we will see the benefit of this in the long run. And we won't have to worry about, even worst case scenario, even going further from this, but we have to focus on doing the right things right now.
Thank you, Mayor. All right. Well, that will conclude our press conference. So thank everybody for participating. I'd like to thank the media as well.